Well, that's right, Steph. I'm outside of the O'Brien Community Center in Winooski on Mallets Bay Avenue here. Very crowded in that hearing earlier today. We'll get you more details on that in just a moment. But there's another independent panel that's looking into the deaths of Desiree Sheldon and Peyton Giraud. Now, despite calls from the governor to speed that process up, the whole committee, which is 23 people, has yet to meet in person. I spoke with the committee co-chair earlier this week, and he tells me that they have had some online exchanges and some conference calls, and says the whole process is pretty complicated.
I would have felt it unreasonable for me or members of VCAB to suggest that we go faster.
VCAB co-chair and pediatrician Dr. Joe Hagan believes the board investigating the deaths of Desiree Sheldon and Peyton Giraud, which is composed of Vermont Citizens Advisory members and special appointees, is working as quickly as they can.
We have had a very definite plan of action and our own timeline that's been waiting to flip the switch.
Hagan says part of the delay is a matter of process. The board waits for Vermont State Police to finish its investigation before starting their own. But as Hagan said, State Police wrapped up 3 or 4 weeks ago, and at this point, several board members have not seen the documents regarding Desiree's death, and they do not have the Peyton documents either.
Remember, too, these are highly privileged documents. We're talking about medical records. We're talking about social service records. We're talking about court records. We're talking about the things that everyone holds as very private.
Still, around the same time Hagan got word VSP was wrapping up, the governor sent a letter to Dr. Hagan urging the board to complete the job swiftly.
That is not correct. I'm not sure what you're alluding to. The governor didn't tell us to hurry up. The governor said, now you may go ahead.
He did ask you to hurry up. He says, I write to you today to urge the board to meet as regularly and as expeditiously as possible to review both of these deaths. And he's come out and said this at a press conference as well, that he asked you to speed things up.
My interpretation was, now you may start, and I hope that you will do this with thoroughness and with alacrity so that we can have our findings.
WPTZ also wanted to ask Dr. Hagan about the composition of this board. 23 members from various backgrounds, including law enforcement, children's advocates, a foster parent, and parents.
We noticed all 5 of the medical professionals on the board, including Dr. Hagan, are affiliated with Fletcher Allen Healthcare. At least one children's advocate has raised questions about the medical center and if it could have done more to protect Peyton at a hospital visit just 2 days before his death.
What about bias? Do you worry about that?
I don't. I mean, I'm a pediatrician. I have practiced in this community for almost 40 years. I've worked in child abuse much of my career. No, I don't worry about bias.
Actually, I was not aware of that. That's a good question.
Human Services Secretary Doug Racine said he might send a letter to Dr. Hagan asking him to reconsider the panel makeup. But Hagan says he won't remove anyone from the board. Rather, another board member will offer checks and balances.
But you bring up a good point. I'll have to ask one of my non-physician colleagues to take special attention to that.
As to when the board will provide their report and also recommendations, Dr. Hagan says he hopes it will be by the end of the summer. And again, all 23 members haven't met in person just yet. They plan to do so next week.